A COVID vaccine for infants may be just around the corner. Moderna says its shot is showing to be safe and effective in children 6 months to 6 years. The company said the vaccine has a robust neutralizing antibody response. There were adverse reactions, the same as adults, but are said to be mild. Moderna's study shows the vaccine to be 44% effective in children under 2, 38% effective in children ages 2 to 6. Moderna is now asking the FDA for emergency use authorization. Well, millions of parents have been waiting for a vaccine for the littlest ones. How soon could they get it?
Well, joining us now is Dr. Jose Mayorga. Not the first time. He is Executive Director of UCI Health Family Health Centers. Welcome back, Doctor.
Great to be back with you guys.
Well, you know, the Moderna vaccine has been highly effective, we were told, in adults. But how is the protection for our youngest children?
Well, I think this is a huge game changer for our parents who've been hoping that these children will now be eligible. These are 18 million kids under the age of 5 who will now have the option in the near future. So how effective is it? Let's keep in mind that the vaccine that they studied is the same vaccine that was administered to adults over a year ago. And so this is an important point because now we're taking a look at how it responded during this Omicron surge. And so the percentages that were just quoted a minute ago, of course, that's kind of surprising to one, but the most important fundamental thing that this vaccine needs to do is prevent serious illness and infection. And that's what this is already demonstrating according to Moderna.
So, Doctor, let's talk about it. If you can predict, how long could it be before the FDA approval, CDC approval, and those shots going into those arms?
Well, I'm sure many parents, again, wanted this done yesterday, if not months ago, but it does take its typical process that we've probably become familiar with at this point in time. It's going to take probably about 7 to 10 days for the FDA to get all the information, have that independent body make a decision, and then subsequently the CDC to take it up on their special committee of immunization practices. So there is some time still that's needed. Of course, Moderna is collecting all the information to submit it to get that emergency use authorization.
Well, doctor, just how effective is this vaccine in helping the youngest children fight off the Omicron variant, which accounts for most cases now? And now we're looking at a newer variant, the BA.2.
Yes, and I think this is a really important thing to kind of appreciate. You know, I think there's getting the infection itself versus getting seriously ill from this infection. Now, I want folks to really appreciate this. What's important is that 400 children under the age of 5 have died since the onset of this pandemic. So that's a really significant amount of children. None of these children should be dying due to something that's going to be preventable. Now, the Omicron surge has shown an increased admission of hospitals stays in this age group. That's a really daunting situation considering that we thought Delta was the worst of the variants. No, this one has actually caused an increased amount of hospitalization in this age group. So for me, as I look at the options of getting this vaccine to the children we care for, I think it's really important to appreciate it will prevent that serious illness and hopefully that hospitalization.
Obviously, you understand that parents want to protect their children. So what are the adverse reactions to this Moderna vaccine for children? What do we know about that?
Well, the nice thing about the study is that it took a quarter of the dose that's used in adults. In other words, they only used 25 micrograms versus 100 micrograms. It was able to demonstrate the same level of antibodies. And the most common side effects that Moderna is sharing is that it caused fever. Now, fever, mild fevers, we typically see those in this age group during their normal routine vaccines that we give them now. So that's a pretty good indication that it's going to have some great safety profiles.
Well, that's good news. Thank you so much, Dr. Jose Mayorga, for joining us this evening.
Thanks, guys.
All right.